dedicated his life and his company to helping those of the last wagon in healthcare do their jobs in the best way possible and creating new opportunities for those entrepreneurs who are willing to take risks. I love to listen to Jonathan talk. His narratives come a mile per minute. His illustrations and metaphors help me envision the problems and their solutions clearly. And he is very, very funny. You will be able to hear Jonathan's voice as you read this book. It is an easy, insightful, and entertaining read. Jonathan, thank you for writing this book, for what it says and how you say it. Clayton Christensen, Harvard Business School, January 2014. Introduction. It's a steamy summer night in New Orleans in 1990. I'm 21 years old and gunning an ambulance down Bienville Avenue toward Charity Hospital. My uncle is President of the United States, and my cousin will take over the same job in a decade. Big things are expected of me, but I've always had trouble succeeding along traditional Bush family lines. Surrounded by a brother and cousins who are outstanding athletes, I have trouble throwing and catching. I'm also dyslexic and struggle at school. I fidget in classrooms and my mind wanders. So now, between my sophomore and junior years of college, I'm exploring a new path. It involves doing good by running red lights and crashing through windshields to rescue people. I love it. Charity Hospital has what is widely considered a crack trauma unit, perhaps the best in the country. Located in the heart of America's murder capital, the New Orleans team gets loads of do-or-die practice. But the 75-year-old man stretched out behind me right now isn't an emergency case. He just feels bad. I think he has high blood pressure. The shootings every night in his neighborhood can't help. So he called 911. He met us on his stoop, fully dressed and carrying an overnight bag. He is taking what amounts to a $400 cab ride paid for by Medicaid. I joke that I'm driving a cabulance. When we get there, the triage nurses will point him toward the waiting room, where he'll probably sit for hours while doctors rush to treat the stab and gunshot victims we haul in. Finally, when a doctor gets a couple of minutes between turns to see this old man, he'll give him a prescription and send him on his way. This visit costs the system hundreds, even thousands of dollars. The patient clogs up the hospital and gets rotten service, and he'll be back in a week or two. After all, his condition is chronic. Now imagine for a moment how dramatically this interaction with a patient would change if hospitals like Charity had to run like a normal business. The hospital, which incidentally was destroyed 15 years later by Hurricane Katrina, would have to turn its business model upside down because virtually no one could afford the bills. Even in this impoverished nook of America, rates run about the same as those at the Ritz or the Beverly Wilshire. It's thousands of dollars per day, plus charges for incidentals from bandages to syringes. The sad truth is that in hospitals we pay for a Ritz experience, but the service we get is below the YMCA. No, the business model of this hospital, and practically everyone I've encountered since, is predicated on mysterious and outrageous charges that someone else, either an insurance company or the government, will eventually pay or haggle down. A competitive market is nowhere in sight. There is almost no consideration of the patient as a customer with choices, someone who could conceivably compare prices and service and value. In our convoluted healthcare system, the insurance company is the customer, and the patient, even a poor one like the guy who's getting ready to climb out of my ambulance, is a widget to be processed, administered, and billed for. From the system's perspective, he's a potential stream of revenue. Now, if this were a real business like a pizzeria or a nail salon, the hospital would have to seriously rethink its pricing model. Instead of pegging its invoices to Medicare or Medicaid reimbursements, or whatever it can get from private insurers, it would instead have to focus on the gentleman in my back seat as a customer. The service he needs at this stage in his life